How do you figure out you have a hernia? There's a couple of different types. There's the kind that we're born with that develop from very small openings in the musculature that with time and wear and tear tend to open up, and we can get our intra-abdominal contents and fat trapped within them. The usual presenting symptom is pain. The other type of hernia that we see is called an incisional hernia, where somebody's had an operation done before on their abdomen, and the area where the abdomen was closed has opened back up. And so this develops a new hole that, again, over time with wear and tear will gradually stretch and cause that patient some symptoms.
I had a small hernia in my stomach, and I got a stomach virus and was doing a lot of throwing up. And within 4 days, my hernia had grown to be the size of my hand. So my family doctor sent me over to see Dr. Duffy, who immediately put me in the hospital and did surgery on me.
Janet came into our office. She was having a lot of abdominal pain she'd been suffering with for a while, and because of multiple other medical problems that she had, it took a while to figure out what exactly was going on. We diagnosed her with a hernia that she had in her abdomen, which is fairly large. We were able to offer her an operation laparoscopically. We were able to use a camera and very small instruments to repair this through 2 tiny incisions. And as a result, she was able to go home from the hospital the same day. She had much less pain as a result, and she was able to go back to work fairly quickly.
I'd had abdominal surgeries in the past, but this was very minimum amount of pain involved. Dr. Duffy was very explanatory to me and my son, who was there with me. Dr. Duffy was very likable when I first met him because he was so informative. In my visits and the few times I've had to call him after surgery for questions, he's been very nice about returning my phone calls and making sure I understood what he was saying. He just takes awesome care of his patients.